Okay, so my patient is patiently waiting. All right, the patient is being familiar with the case. So I've picked case 8. All right. Oh, sorry. This is the last case on your practice, on your lab handout for today. All right. So case 8, Mr. G. I'm gonna need that chair. Mr. G experienced MVA 6 weeks ago and is complaining of pain and spasm in the cervical spine, cervical and upper thoracic muscles. He's 58 years old and has a history of prostate cancer, which he states is in remission. States his pain is 6 out of 10 with activities and palpation. You note several hardened areas of tissue in the lower cervical muscles. All right, are utilizing appropriate blah blah blah. Okay, so I get that case. I'm thinking to myself, okay, primary complaint is pain, right? 6 out of 10. Okay, so I know that that is what I'm going to be treating. So the other thing that I see in the case is he has several hardened areas of tissue. So I'm thinking maybe there might be a trigger point in there. At the same time I'm thinking this, our proctor is telling our patient that we have trigger points here and here. So when we palpate them, he's going to say, ow, I feel that somewhere else. Okay? I know that that's going to be a trigger point. So when I do my palpation, I know I'm going to use what techniques really quickly. They're easy. Stripping. Specific compression. Okay? All right. He has a history of cancer. I'm going to reinforce that, but it's not going to count as, I'm not going to ask that as one of my questions because I already know. Does that make sense? I'll reinforce it, but I should probably ask additional questions. Okay? So, this is what it's going to look like. Hi, how are you?
Good, how are you?
Mr. G?
Yes.
Hi, my name is Dan Pinto. I'm a physical therapist. I'll be working with you today. So I understand you were in a motor vehicle accident?
Yeah, about 6 weeks ago.
About 6 weeks ago?
Yeah.
Okay. Do you have any pain associated with that?
Up in the neck region up here, like my upper back.
In your upper back?
Yeah.
On a scale of 0 to 10, where 0 is no pain, 10 is the worst pain imaginable, how much pain would you say you're in right now?
Probably 5 to 6.
5 to 6?
Yeah.
Okay. I see in your chart that you have a history of cancer.
Yes.
Let's elaborate that. Is it in remission at this time?
Yeah. Yeah,
Okay.
it was in a couple of years ago, but now no.
Okay. Did you have any spreading of that cancer at all?
No.
Okay.
Nothing like that.
All right. I just want to ask you a couple of questions regarding your medical history overall.
Sure.
Do you have any cardiovascular disease, including high blood pressure?
No.
No?
No.
Okay. Do you have any recent infections or anything like that?
No, nothing like that.
Okay. Do you have any impaired sensation in your neck or in your upper back at all as a result of the accident?
No.
No? Okay. Last but not least, do you have any allergies to any lotions or creams or anything like that?
Not that I know of, no.
Okay. So based upon what you're saying, I think massage would be really indicated for you, and I think it could help loosen up some of that discomfort that you're having in your upper back and neck.
Mm-hmm.
That requires me to first evaluate you. All right. By doing that, I'm going to have to feel around on those muscles, poke and prod a little bit.
Yeah.
All right. From there, I'm going to have to use massage techniques. All of that requires me putting my hands on you. Is that okay?
Yes.
Okay, very good. So what I'm gonna do is I'm gonna go wash my hands. I'm gonna gather some materials. I'll be right back. We'll get you all set up and then we'll get started on the massage. Sound okay?
Sure.
All right, hang tight. All right, nice deep breaths.
It's like his dad is right.
All right.
1 hour later.
Proctor, did I fail yet?
Not yet.
Not yet.
Yeah.
Two hours later.
Okay, so I'm saying to myself, do I have everything? I have pillows, I have 2 towels, I have a sheet for draping, I have a chair that he's gonna sit on. That should be everything. Lotion. Got it. All right, Mr. G. So, the best way that we're gonna hit your upper back and your neck is going to be sitting down, okay? Now, in order to be effective for this, I'm going to need to get to the level of your skin. So that's going to require you to take your shirt off, all right? How we're going to do that is we're going to stand, we're going to come right over here. I'm going to use this as a guard, all right, to block you. You're going to take your shirt off. When you're done, you're going to reach around for this, tie it right around the front of you, okay? Then you can come around and have a seat. When you sit down, you're going to put your head right into this little face holder and just relax your arms by your side. Fair? Right. So wrap it around your arms. Your arms are actually going to be out here, right? You're going to wrap it around your body this way. There you go. All right. Give that a tie up. I'm going to hold the bottom. It's like your wedding day. We're going to have That's fine. Take your time.
Good.
All right. Let's come right over here. Have a seat. I'm going to bring you the seat to the side so I can stand behind you and this chair won't get away from you. There you go. Very good. Okay, so to start, I just want to take a look at your skin. All right, you don't have any wounds, anything like that. No redness. Okay, now I want to do something that's called a capillary refill, and it's just going to let me know how much blood flow you're getting to your skin. Good, and if it's adequate, very good. That feels okay? Good, that looks pretty normal to me. All right, so now I just want to feel around on these muscles. If you have any tenderness, just give me a shout.
Oh, right there, right there, right there.
Right there, okay. So now when I press there, do you feel that pain anywhere else?
Going, yeah, down towards my mid back.
All right, so it goes down a little bit. All right, so that might be what's called a trigger point. All right, we're gonna use some massage to help that as well. Okay? Other than that, things seem to be pretty tight. All right? So I'm gonna grab my lotion and we're gonna start our massage techniques, okay? So I've done my exam. All right? I've hit my skin integrity, I've hit my capillary refill, I've hit my palpation, okay? And you can see I'm kind of thinking out loud here, and that's perfectly fine. Okay. So ready, we're gonna start our massage. At first, I just want you to just try to relax as best you can here, all right? If at any point you're feeling pain or discomfort, just let me know, all right? Do you feel comfortable?
Yep.
Very good. All right, so now we're just gonna get used to the sense in my hands here. Does that feel okay? Good. All right, I'm going to apply some lotion. All right, we're going to go up and down the neck and back a little bit, nice and easy. Pressure feels all right? Tolerable, right? You're a sports fan? Eagles are reporting to preseason today, right? Okay. Take you're not an Eagles fan. It's a shame. All right, so now what I'm going to do is I'm going to start to get into a little bit of what I call petrissage techniques, all right? So a little bit more pressure. Again, if it's uncomfortable, just let me know.
Okay.
Good. All right, now we found some areas that were a little tighter, all right? So now what I want to do is I just want to work on those areas a little bit more, okay? That's going to include a little bit more pressure. So you're already at a 6 out of 10 pain right now, All right, I don't want that to increase more than 2, so you shouldn't get up to a 9 out of 10. All right, if it does, let me know. I'm using too much pressure. All right, so that area was right here. Okay, good. Just go to the side of it here. All right, same thing on this side. That was a little tender on both, right? Whoa. Back down. Okay, now last one. I felt okay? Pressure was good? Okay. Now I'm just gonna remain pressure over those 2 areas, okay? We're gonna go for 30 seconds here. Let me know how that pressure feels, all right? Ready? All right, 30 seconds goes by quickly. All right, so a couple of additional techniques to petrissage. All right, deep effleurage. All right, now we're gonna slow some things down a little bit, back to the superficial stuff. So who do you like, NFL-wise?
Green Bay.
Green Bay. Yeah. Good for you.
Best quarterback in the game.
Wrong.
That's up there. All right. So, the techniques that we use today, all right, they might promote some redness onto your neck and back. All right, that shouldn't last for too long. If it does, you can always throw some ice on it. All right. The idea is to help decrease the pain and improve your motion. All right. So that's it in terms for the massage. You can hang out right here. I just want to make sure that we still have some good blood flow coming into the skin. So we're going to recheck your capillary refill, which looks pretty normal. Very good. Now I use lotion. Would you like me to wipe it off for me?
Sure.
All right. Okay. All right, so what we're gonna do, you can stand up. All right, I'm going to put the shirt right here. I'm gonna tent you here. Okay, so go ahead and untie it for me. Good. Put the shirt back on.
Show everything.
All good. All good?
Yeah.
All right, so go ahead and take a seat. So when we started today, your pain was around 6 out of 10. How would you rate it right now?
Probably 5.
Probably 5? All right. Good. So we're able to bring it down a little bit. So we're able to bring your pain down a little bit. You know, going forward, I think massage can be helpful also with some strengthening and some maybe flexibility exercises. All right, but we'll continue with our plan going forward so you can make appointments up front on your way out.
Sure.
All right?
Yeah.
All right, it was nice to meet you.
Thank you.
Okay, very good. So let's go through what we think. Let's bring up the rubric. Okay, so I clearly introduced myself, right? I attained the pertinent medical history based upon what I had, right? Asked 3 questions regarding contraindications. So check, right? I washed my hands, for sure of that. I got a pre-massage scale of 6 out of 10 pain. There were no allergies to cream or lotion. I had all of my materials prior to positioning the patient, right? Positioning and setup. I select the position appropriate for the condition. So I chose sitting. Another option might be prone, okay? Prone would be acceptable for this. I think sitting was good for me because I could get to the neck and upper back pretty easily. All right. Drapes the patient to exposed treatment area. Remove all local jewelry. There was no jewelry, no necklace, all right? So if someone's wearing a necklace, I would probably have them remove it. Not in this case. Inspects area to be treated. I did my capillary refill test. I inspected the skin integrity. We are asking you to do capillary refill pre and post, all right? So do both. Palpates to determine irritability level, pliability, and trigger points, which I did, all right? Not all cases will have trigger points, so you're just taking note of things like swelling or any limitation in scar mobility, things like that. Decision making. I believe I selected the appropriate treatment level, right? Cervical spine and upper thoracic. Appropriate massage techniques. I did petrissage. I determined that there were trigger points, so I did stripping and specific compression. I'm pretty sure I explained the rationale for the choice of techniques. I think if anything, I might probably lost a point or two there. I would give myself a 1. Probably explained the techniques of specific compression and stripping a little bit more to the patient. Application. Apply as chosen in a competent manner. I think I had good rate, rhythm, direction. I think I used the appropriate duration and pressure. I hit all targeted areas. I was pretty good with my sequencing of strokes. You can see I went from specific compression. As I'm talking to the patient, I can do superficial effleurage, always as a transitional stroke. Body mechanics, probably fair. I don't know, I didn't really think of that. Feeling okay. I'm gonna give myself a 2 there. Patient education. So educating throughout, making sure that they are tolerating the massage well. He's informed on why we're doing the techniques that I talked about. And the patient response, we talked about the results afterwards, making sure that he's aware the skin might be red. I determined my efficacy, which I guess was fair. 5 out of 10 pain, tough crowd. What are we gonna do with these patients? But yeah, that would be it. Any questions on it? No? Does it make sense? Was that helpful?
Yes.
Okay, good. Yes,
Will there be like one of you guys here for Open Lab?
Tuesday.
There will be like a professor here though, right?
Yes.
Okay.
Yes? All right. Then the SOAP note, we've talked about that. I don't want to keep you guys too late. But we're documenting subjective, objective assessment plan. And then I just have to palpate and I'm good. I can enjoy the rest of my summer. All right? Or until Friday, whenever your next final. Okay? So, in the meantime, practice these cases just like that. All right? That is a very good way to practice. If you can run through those 3 cases on putting it all together and the 2 that are here, you guys are going to be fine. All right? Very good. Yeah.
Documentation, are we going to be writing it or are we going to be telling?
I believe you're going to be writing it
Okay.
with Dr. Cochran. So review her slides.
Abbreviations.
Review your slides.
I'll work on it.
All right.
Full.
Okay, guys, let's break it down. Thanks for being patient with me another couple minutes.